welcome to this episode of Attachment Theory in Action podcast. Today, I am excited to welcome Dafna Lender to be my guest. Dafna is an international trainer and supervisor for practitioners who work with children and families. She is a certified trainer and supervisor / consultant in both theraplay and dyadic developmental psychotherapy, DDP, as well as an EMDR therapist. Dafna most recently brought out her book, Integrative Attachment Family Therapy, and I'm really excited to talk to her a little bit about that today, as well as getting some of her thoughts on her upcoming webinars that she is going to be delivering for us. So, hi, Dafna. So glad that you're here to join us today and share some of the work that you've done and your expertise and talk a little bit about your book. I always love to start these podcast episodes with a question that really talks about how did you get to where you are today? And really, we know that our childhood plays such an important role in who we turn out to be as adults, not only from the attachment perspective, but just generally. And so, was there anything in your childhood that you felt led you into the work that you do today?
Yes, for one, I think I always felt like an outsider or the underdog. I grew up in a family that there were a lot of feelings under the surface that were sad and weren't talked about, trauma, whether it was the Holocaust or whether it was the war that my family lived through in Israel, and really a lot of attachment issues. So it seemed to me that I channeled that into being a champion of animals and trying to pick up stray animals and fighting for that kind of underdog. But when I moved to Israel, or from Israel to America, I didn't speak English. I was 6 and felt always like an outsider. Didn't become an American citizen until I was 19. And there was a time when we were actually illegal immigrants and were not allowed to go back to our home country. So there's a lot of feeling of looking at it from the outside, looking at the world from the outside and trying to fit in or figure out stuff and feeling like I didn't fit in. And it persisted, the feeling of looking from the outside and just wanting to maybe root for the underdog, but ultimately the underdog was me because I felt like I didn't have an advocate or, so I wanted to become an attorney because I was going to fight for rights of the underprivileged. But when I graduated from poli-sci at University of Illinois, I got a job at the Illinois State Senate, and then I saw the way the sausage is made in terms of how awful decisions are not made for good reason. They're made for political reasons in the political system. And I didn't think I could make change that way. So I left and thought, I had a therapist who was a social worker, and he basically changed my life. I healed a lot. That was when I was 19 or 20, or no, excuse me, when I was 22. Excuse me. Sadly, I have a cough. And he said I would be a good therapist, or I wanted to be like him. So that also really melded or gelled with my desire to help people. I thought I could definitely help people on an individual level, something I didn't feel I could do on a political scale. So that's how I got from there to here.
Okay. I mean, wow. And thank you for sharing just a piece of your story. As somebody who I feel I had a probably privileged upbringing, I think that it's so important for all of us to hear stories of everyone's experiences, because everyone's experience is different. And it's so important for somebody like me to understand that the impact that a child's experience can have on them as they get older and know that it's not the same as mine. And it doesn't make one right or wrong. It's about being in a place of really being able to reflect and think about that person's experiences outside of my own experiences. And it sounds, not only did you have generational trauma, hearing you talk about like the Holocaust and having family members that, you have that have had direct experience with something like that. For me, that's something that's so hard to fathom. And so again, it's so important for me to be able to hear other people's experiences, but then to also have your own trauma and family trauma taking place while those generations are trying to process their trauma. I wondered, tell me a little bit, how was that for you?
I just want to make a side note that it's interesting. Right now, everybody there has been and there is and always has been currency of using your own history as a therapist in order to identify with the client, or in our times, it's used to make yourself famous. So one of the most important things that famous therapists do who are on the speaking circuit, they talk about their trauma history, and that makes them somehow a legit, it makes me have some legitimacy, and it draws people in. And I want to say that the fact that I have a story with both intergenerational trauma and war and immigration and difficult things. So that doesn't make me a better therapist than somebody. For example, my idol is, and probably everybody's idol who knows her, is Phyllis Booth. And she's 98 and a half. She created Theraplay. And through, every time I've talked to her about her history, she has the most solid attachment and essentially the most, what it seems like, idyllic upbringing, but it's not that she's not avoiding anything. When you say idealized in attachment speak, it means that the person is denying that they had hard times with their parents and that they can't really speak the truth about what happened to them. Well, Phyllis is very authentic in saying that she was, she was so supported, and the family had so many both joyful times, and when she was sad, she was comforted and wasn't rejected, and that seemed to go for both parents as well as grandparents. And she's the best therapist in the world. And she doesn't, if anything, she doesn't go around, wouldn't make up stories about that she was traumatized in the first place, but she doesn't go around saying my history makes me a legitimate therapist. She just is so secure. And so I want to put that into a frame, because in the world, every therapist starts with like, this is my trauma history, and so I'm legit.
I really appreciate you bringing that up and highlighting it. One of the things that whenever I'm working with a group of professionals, usually helping professionals, whether that be clinicians or educators or other, child-facing professionals, one of the things we often talk about is our why, and knowing the value of your why. And myself personally, I've struggled sometimes because there isn't a trauma that I've experienced, a huge trauma. Absolutely. Were there some times of hardship growing up? Yes. Were there challenges? Yes. But, I had great relationships for the most part with my parents. And so I've struggled personally with, am I really allowed to say that my why is because I had a good upbringing or a secure upbringing? That, let's put it in attachment terms. I had a secure upbringing for the most part. And so I think it's great that you're kind of making that distinction. And for me, it's not about trying to yes, we can have empathy, but it's not about trying to put yourself into that other person's experience. It's about accepting their experience for what it is, whether that's one that included a trauma experience for them or one that didn't.
Exactly. And that it doesn't make a better therapist to have had trauma.
Right, right. So, but if you're comfortable, I would still like to hear a little bit about how it was. Maybe we'll use the word navigating the traumas that your caregivers and ancestors had experienced alongside those most likely traumatic experiences of coming to a new country where you don't speak the same language, and those things.
Yeah. Well, I'm very comfortable talking about it. I mean, there was a sense of that everything was opaque. There was nothing was seen. I couldn't see anything through my own eyes in the way that was clear. It was all submerged and under the surface. There was a ton of sadness. My dad would go from being just absent to being rageful, and my mom was super depressed and felt really trapped in the relationship. And so she couldn't. She was warm towards me and supportive in her way, but she couldn't protect me from my dad, and she couldn't stand up for herself, and that was really difficult. And I think what that brought, in my physically, it created a situation where I didn't have a feeling in my body. There was just a disconnect between my head and the rest of my body, and I developed a pretty severe eating disorder and was very depressed. I remember in senior year of college, not being able to get out of bed, staying in and missing my classes. And then finally, with a very heavy heart, just getting to my 5 p.m. class just at the last minute, having missed days in bed, and yet still operating on the outside as if I was okay, but it was really bad in the inside. And then meeting, two things happened. I met a boyfriend who didn't end up being my life partner, but I remember he said something. There was a spring break, and I was going to go home and do nothing. And he said, "Why don't you come with me to Toronto to visit my aunt?" And I was like, "Wait, can I? Am I allowed to? Am I entitled to go?" And he's like, "It's not going to cost anything," because I presumably it was about money. And he said, "Why? Why you can get in the car and you can drive with me, and it won't cost anything, and we'll stay at my aunt's house." And it was something like a light bulb went on that he was advocating for me and saying, "Why are you not allowed to live?" I was so scared of doing anything for myself that was, outside of like the basics. And so that was a perspective that opened up for me, where I needed that, person who we ended up being together for 7 years and cumulatively, and he, supported me in finding my voice, and saying that I was entitled to things like joy or experiences, or getting the sort of oppressive yoke of my kind of parenting off of my back. And so that led me to go to a therapist who was just the same, very similar process, but in a therapist role, and entitled told me that, that I'm entitled to draw boundaries and have a happy life, and sort of not feel so oppressed and limited. And then things began to really, it's kind of like the sun broke through the clouds, feeling really, really, things are absolutely dark and not clear, and I have no idea what's going on. And there's like suddenly, when there's that, oh, and the sun comes through the clouds. And that was definitely also a that was such a empowering experience that there's no way I wouldn't, talk about the why. Like, I would definitely want to provide that for other people.
Mhm. Would you
going
almost,
forward.
would you say that he really was maybe your first attachment figure, your first secure attachment figure, or at least a piece of that?
I think it was combination of my ex-boyfriend who's a friend now, and the therapist. So we talk about that earn secure, right? And the status of becoming earn secure has to be with a very intense and close relationship. And those two, were intense and close.
Mm-hmm.
So yeah.
I I like the I think that it's always important and helpful when we can find ways to help those that we are supporting through therapy or school, for example, to help them find those ways of feeling empowered as a result of building that secure relationship with them. And I remember having a conversation with a client about the behaviors that they were now demonstrating that allowed them to survive through their childhood. That those were the survival skills, but only now when those survival skills were not needed, they looked odd and they caused problems in other relationships and so on. And I just almost kind of like what you described, could see the sun appear for this client. The light bulb came on of, whoa, I'm not defined by that behavior. I'm not crazy, to use
Exactly.
her words. I survived something that was really difficult, and my brain has learned how to cope with it. My body's learned how to cope with it, and now I can start letting some of that go.
Yeah. And I don't know if you work in the school at Chaddock or in the residential or both. Which one
I have worked in both.
Okay. Because I think what people who work in residential school frameworks, where children don't have their parents or caregivers nearby, they're already in a really extreme situation, and the therapists and school staff and so on have a really huge impact on the kids. And so being not looking at the children as needing to be fixed or having uh, you know behavior problems, but really helping them just discover themselves and discover what their narrative is and their meaning in life, and supporting them and showing them that they're courageous, I think, is that attachment figure status that it's I feel like it's on steroids when you're a therapist for a kid in residential, but it's just really important how you do it, because I know that the in all therapy, but especially in residential, there's a need to sort of focus on improving behavior so that the child can go home because there's pressure from the system. But I think that's not the role of therapy. The role of therapy is to help the person and be really supportive by drawing out who they are and admiring them and being that more and more that attachment figure than a problem solver.
Mm-hmm, mm-hmm. Well, one of the I know you know this, but one of the neat things about what we do in our treatment model is that we have this pyramid approach. So, really working on the attachment needs first and foremost at the bottom of that pyramid, but also knowing that we can go back to those. Once we've built that relationship and the child is experiencing more of that secure base, to move up to more of that front brain problem solving, trauma processing, but knowing that we can and we should always go back to maintaining and continuing to establish being that secure base for our children and families. But something that you brought up, we'll shift gears a little bit now. You mentioned about not seeing the child as a behavior problem, or seeing the child as the problem. what I loved about your book, and I want to make sure I get the title right, but in integrative attachment family therapy, I love the use of the word integrative, that because one of the things that we focus on at Chaddock in our, don't want to say a motto, but our approach is that the client is the relationship. And so your book really focuses on the parent-child relationship being misaligned. So maybe tell me a little bit more about that.
Yeah. I think that therapists who, first of all, more people have to work with children in general. So not a lot of therapists work with children because it's really, they're messy. They don't want to cooperate. They're not there out of their own volition. And they also come with parents, teachers, blah, blah. You have to talk to a million people. It's really intense. There's so many reasons people don't like working with kids. So therapists work with adults. And so one of my missions is I want to convince people, more therapists to work with kids, but just not in any old way. I think that the way to do it is with the parent and child together, actively present. Parent has to be the main agent of change in the child's life. So that's my mission. And it hasn't been an easy battle because people don't want to bring the parent in. There's so many reasons. There are very good reasons. Parents are defensive. They want you to fix the child. They are angry that they have to change. They're very sensitive about being criticized. They're afraid about looking into their own history. And it's a lot. But I think that working with a child alone is kind of phony. Like it's hard. You have to really, really legitimize why you're going to work with a child alone. Mm-hmm. I'm not talking about residential in your situation where the parents live so far away. To take a child into a room and to spend 50 minutes with them a week and then occasionally talk to their parents, I find that offensive. People say, well, I tried to get the parent in, but they don't want to come. They want me to fix their child and they want to go to Target. Well, it's our job to convince them why that is not going to work. It's a waste of their money and why it's not the case and not cooperate with that system. Mm-hmm. Excuse me. So the integrative attachment family therapy is a model that I created. I try to make it as simple and straightforward as possible, only not because it's an easy process, but because I want people to have like therapists to have a toehold where to start and to feel like they have the ABCs and the tools that they need. And so I wrote it down, in a book, and it's called Integrative because it's not just therapy. I'm a therapy trainer. I'm a trainer in dyadic developmental psychotherapy, but you can't say what you don't lead with, I am a DDP trainer. I am a therapy trainer. No, I'm a therapist and I have to make sure that it fits the client. And so I learned a lot of other things that also really help. And so I don't want to be pigeonholed into being just a therapist or just a DDP therapist. Mm-hmm. And so what I've done is I, kind of acquired through lots of trial and error the things that I think have been the most helpful. And I wrote it down and tried to make it in a way as both flexible but as prescriptive as possible. And so the format is written out as there's 3 modules, and I can tell you about the modules themselves. But the idea is that the parent is going to have to do about 50% of the work in the parent only meetings are 50% of the sessions. Okay. So if you start with that understanding, all of a sudden it's a whole other program than when people call a therapist and say, my child needs therapy. Mm. Then it's like, oh, wait a minute, hold on a second. You're saying I am the one who's going to do the work. So, okay, let me, the parent's like, okay, let me grapple with that. And all right. And I will explain it to them and we'll get the ball rolling from there, from that rationale of why am I saying this? Why am I offering this? Why do I think that for the most part, this is a good default way to go. Now, people have challenged me and said, aren't there plenty of cases where you would work with the child alone? Yeah, but they're not the majority. And I want to flip to therapists out there. I want to flip the premise that, you start working with the child alone, and then figure out maybe subsequently that there's some minority of where you should do parent-child work together. I think that's really hard to shift from working with a child alone to working with the parent-child together. People also say, well, then I do work with a parent. I work with the child alone separately and the parent alone. I don't think that cuts it either. I want to see the real live dynamic, because 90% of what's going on is untold and non-conscious, and it has to do with the way they look at each other, the way they move towards each other or not, the small little energetic things that happen and set the child off. Mm-hmm. And you cannot attest to that by having an interview with a parent. They can't speak to it because they're not aware.
For those people who might just be listening to the podcast, I want to share with them that I'm sitting here smiling because I completely agree with everything that you've just said. I want to dive just a little bit deeper into a couple of things. One of the things that you said that's struck me is it's very difficult to start working just with the child and then bringing the parent in. And certainly correct me if I'm wrong, Dafna, but in my mind, some of the reasoning for that is that what you've hopefully done is built some of secure attachment, that earned secure attachment with that child. But in the meantime, you've also pushed away any kind of attachment that they may have had with the parent by keeping that parent at a distance for however many of those sessions that you've had. And so now we're almost having to go back to the beginning again of, creating the message or giving the message to the child that this is about the relationship with the caregiver rather than the relationship with me as the therapist. Does that make sense?
Yeah, it makes sense. And you're exactly right. I don't call my relationship with a child an attachment relationship and think that it, detracts from the child attachment connection to the parent. I think attachment is much more profound than that. But the essence of what you're saying is correct, which is that it's a lot easier for me to spend 15 minutes playing with a child, and then for me to have to go and they like me because I'm not their parent. Mm-hmm. And then for me to go from something that's easier to something that where now all of a sudden I'm including the parent and I have to back out and not be the most interesting adult in the room. Mm-hmm. It's just makes it really an uphill battle for me as the therapist. And the child is, they often they're not happy with the situation. And so why would I want to set up a situation in which everything's going to just be even more difficult, like as therapy progresses? So I'd rather just get this set point from the beginning that the parent and child are there to work together. And then I'm not the most appealing person in the room. Mm-hmm. And then I'm not going to allow them to avoid, I'm not going to sort of be colluding in saying that you should be apart and deal with your issues separately. No, we'll deal with them together from the beginning. And hopefully it'll be easier going forward as things improve in this formula.
And so you talked about, the parent, and again, correct me if I misheard, but 50% of the sessions are going to be parent-only sessions, at least to begin with. What might be some of the things that you would address during those sessions with the parent?
So I conceptualize the model as having three modules. And the first one is the parent preparation and relationship building, which is about 5 sessions. And during that time, that first phase of work, I want to hear not only about what it's like to be the child's parent and what the issues are, I want to ask them about their own attachment history, which is a step I don't skip. And so I do a modified adult attachment interview. And then I want to talk to them about and teach them about PACE, which is playful, accepting, curious, and empathic. It's an attitude. It's created by Dan Hughes, who is the founder of dyadic developmental psychotherapy. And it's a new way of being with children at home and responding to their behavior issues or to conflicts. And one of the things that needs to be done is they need to be able to understand PACE from a psychoeducation point of view, but then they also need to experience it and practice it. And I do a role play with them. And then a lot of things come up for the parents, like I can never do this, or I was not talked to this way and I came out okay, or this is BS because you're totally making the child feel like what they're saying or doing is okay. Or like, this is really, really hokey, different things. Or, I don't understand this. And that is actually some of the most important conversations that I'm going to have, because that is what the parents, their whole ethos about parenting sits on this platform, sits on a foundation of believing certain things about themselves and about their child. And they think that hearing a child and like acting, saying something accepting and empathic and being curious will be, it sounds to them like that's being permissive, or it's something that sounds really like touchy feely, and they don't do that in their family. Well, all those ideas, I want to know about them, and I want to grapple them, help them grapple with it, and have a lot of acceptance and empathy and understand why. But ultimately, I'm not going to give up on this idea that I have to teach them, and that they have to try something new at home. And then that sets us off on a course that's really is where they are challenged to change, and they may feel that they're, a failure and different things. That is why the therapy is so much focused on the parents, because so much of this, and Donald Winnicott said it, and everybody is, familiar and repeats it, but there's no such thing as a child without a parent. There's only a parent-child dyad. It's the crucible in which a child sees herself is in the eyes of their parent. And that's true for adults as well in our important relationships, but it's categorically true for children. So I need the child to be able to see in her mom's eyes in the mirror that her mom understands her, accepts her, and is empathic towards her situation, despite the mom having different feelings and opinions about it that may be very much in opposition to the mom's worldview or her wishes. And that's actually the number one important role of a parent. And that will get that child to feel connected and supported, so that then a lot of other things can evolve. So the PACE attitude is really crucial for parents to grapple and practice. And so after the first module, which are, the parent focused work, we start the second module or phase, which is the dyadic work, which is one parent and the child. So if there's two parents, I work with one parent and the child for a series of months. I don't work with both parents and the child together in the same room. And unless there's a very, very peaceful, calm relationship between both parents. Otherwise, I have a triangulation situation in the room, and it's a lot to keep track of. So at any rate, that second module, it's parent-child work, but every fourth session is still a parent session only. So that comes out to once a month, at least. So that's already, if we're starting with the parents and doing 5 sessions in the first module, and the second module is every fourth session is a parent session only, and that's 25% of the time. So there's also, there's really a lot of parent only work. And then there's a third module, which I always tell parents about, is that there's going to be a time when we're going to work together about 2 to 5 sessions, just you and me, to go deeper into what's coming up for you within the relationship with your child after we've done some of that dyadic work. So overall, that's why I say it's 50%.
Mm. I I'm just really enjoying listening to your approach because as somebody who's worked with children and families, I can go back and think about how many this just how kind of you mentioned it earlier. You said it was simple but still prescriptive, and I really appreciate that approach, and how it enables you to be very directive with parents and caregivers. One of the things I wrote down as you were speaking was this idea of parallel process, because really you're asking the parent what we're asking the child to do. We're asking the parent to put in the work, to dive deeper, to really work to address these challenges that they're having, and that's what we're asking the child to do. And I think, at the beginning of our conversation, you touched on how all too often the parent, wants to drop off and go shopping and come back and have their child fixed without really understanding that they are 50% of what's happening with the child. And I just really appreciate that, because I see that a lot when I work with educators, for example, who are not the parent, obviously, but they are a child's caregiver for, 6, 7 hours of a day sometimes. And often I think they forget or maybe don't realize how much of a part they play in what's coming out in the child, and how important it is for them to dig into their own stuff, for want of a better word, that is coming up for them prior to. And I love that you're including that almost after piece, like now what's happening. So we've looked at some of the past, we're working in the present, and now what's coming up with you, making those links.
Yeah, exactly. I'm glad. And I have a lot to say about educators because I think that they're in a really tough position since they have to be educators first, and the student is disrupting their classroom so much that they can't do their first job, and they're called to be attachment caregivers as well, but their whole classroom is destabilized by this child, and the student, nobody appreciates the demands on the teacher. I think all the teachers want to be an attachment caregiver, but they can't, since their job is to teach 15 other students or 30 other students.
Mm-hmm. I mean, I'm so glad that you said that, and I know any educators listening will also be appreciative of what you just said. And they have an extremely hard job, and they are being asked to be attachment caregivers, and they're being asked to be nurses and social workers and caseworkers and examiners, or people who evaluate the children. There's so many demands placed on them. That's not to dismiss from the hard job that also parents and caregivers have, of course. I just really appreciate that acknowledgement. And but I do still think that it's so important for, we're talking a lot about parents and caregivers, but there's a piece of me in my mind that really wants to just use the word adults in general. That adults need to understand and acknowledge and recognize that children are not their behaviors. We get so stuck on the behavior that's in front of us, and I've done it, most certainly. I still do it. I'm trained in the field, but I still mess up, and I'm still human. That's okay. But it's about being able to then look beyond that and reflect and figure out, okay, what, like you said, the words you use, what's coming up for you, and how do we address that so that we can continue to build this good relationship.
Yeah.
One thing I'm curious about, and I know we're getting close to closing up on time, but one thing I'm curious about is, as you've been through this process with parents and children, are there any parents that turn around to you and say, okay, I need to just keep doing this work with you? We
Of
have so
course.
much resistance to begin with, but then they turn around and like, wow, this is so good and helpful.
Totally. I mean, 100%. I don't, I'm not saying 100% of the people do that, but lots of people are really excited and curious and they feel better because when you realize that uh, what you are feeling inside, and when you go inside, like when you're confronting your child and they're coming at you, and you notice what you're feeling in your body and what you're saying to yourself about yourself, and how, if you're able to be a little bit more present for your child, that's a real turn on. Like it's a motivator. You're like, wait a minute, I can only change myself, but there's a lot of sense of agency or aliveness in being able to change yourself and see that you are going to have ripples in the other with the other person, your partner, your child. And so that's a big motivator for the work. And I do have lots of people who, we just stop working with the child altogether because this is really a journey of my identity as a parent, and how I look back in order to be in the present, and how I navigate my relationship with my child, and learn about my body. A lot of this is very much, it's rather than talking about my parents and what they did to me and how I react and how I want to be not like them and things. It's very much, my approach is very much rooted in Peter Levine's work. I am not a somatic experiencing practitioner, but I have had the privilege of going to his live trainings as a guest, and now this is going to be my third time co-teaching master classes with Peter Levine live. One coming up in the end of October, and so I've learned so much from him about having this sense of, okay, what happens to me in my body when I am encountering my child, and where do I go physiologically, and tuning into that and checking in with myself as to what I'm saying to myself about myself. That's why I also am a EMDR therapist. So there's some things from that, and the ability to tune in so that you can then calm your own physiology, and then be able to be, you can clearly feel that you're more present and open to the child in front of you. And so, I kind of have developed a whole ritual that involves some physical movements that a parent can practice in the here and now with their child when their child is coming at them or confronting them or melting down. And anyway, that whole learning is very satisfying because you feel connected to yourself, and you feel a sense of agency and a dawning awareness that you have something to offer. And so, yeah, it's very motivating.
I think too, it makes, at least how I feel I would perceive it, is that it makes it a little more safe for me as the adult parent. One, because it's something that I maybe feel I have a bit more control over. You said agency, this is my body, not my brain as such. So we're not talking about the problems that I have, or not necessarily initially, should we say, but that physical piece. I think it allows an element of safety, that there's a little less vulnerability, because this is my body, and everyone's got a body, and most bodies are fairly similar in how they work and respond to stress and that kind of thing. And so I really like that approach, and could see how that would help a parent feel a lot more comfortable in this therapy thing that we're doing.
Well, I think you're talking about the phenomenon that where when you talk about a physiologic response, it really just destigmatizes the phenomenon of whatever your reactions when you feel like you're going to yell at your kid or you want to hide and check out. And so that allows you to feel more compassion and be able to, have more self-acceptance. And so that's a cascade of very positive things.
And you can really put a label on it. I mean, I'm thinking about my own experiences when, my baby maybe it's 3 o'clock in the morning and she can't sleep. She's finding it hard to get back to sleep. And in those moments, to be able to take a pause and really look at how it's affecting my body rather than how I might be mentally responding, it feels much better to be able to take note of that and then be able to address, okay, all right, my body's doing this. So, and it's making my brain say, oh my goodness, I'm so frustrated and I want to walk away. It feels more comfortable. And like you said, that agency.
100%. And there's nothing like being awake in the middle of the night with a crying infant who, and you feel so helpless and at the end of your rope to make you feel that sense of just, total like abyss, that you are unable to see the light at the end of the tunnel and how desperate that feeling is. So you want to be able to hang on to anything, anything anybody told you at that time. It's a real crisis moment. So being able to have a step-by-step process, or being able to breathe, or to rock yourself, or count in your mind as you rock in order to note that the time is passing, and is pretty much like the only thing you have to cling on to. And you need that. Yeah.
Well, Dafna, I could speak to you, I think, for an entire day. Your wisdom has been fantastic. I really hope that people reach out and take a look at your book. It is available on Amazon. I saw that this morning. So I just want to thank you for your time, and just to let people know that you are going to be delivering 2 webinars for us, one in October and one in November, that we would love people to come and check out. They can just find more information on tkcchattock.org. And just thank you, Dafna. It's been a pleasure.
It's been my honor, and I love Chattock, and I thank you for the work that you do.